news.
In News for Your Health tonight, many of you have back pain and some of you will need surgery. That surgery often means long hospital stays and even longer recovery times. Now there is a new way of tackling back surgery and it's cutting down significantly on recovery time. We talked with one of the doctors using this technology in our area at the Reston Hospital Center. Think of a robot and maybe this comes to mind. Or this. But how about this small machine, the robot behind this complicated back surgery?
Today we're doing a minimally invasive approach, which is being facilitated by our robotic system here, which allows us to do the implant of those screws with more precision, less radiation, and in my opinion, faster, saving OR time.
The patient, 83-year-old Hung Kyun An, started having trouble walking last year.
Once on the trail, I fell all of a sudden.
In this patient's case, he's developed some really bad cysts and fluid in the spinal joints. We're going to take those cysts off, drain the joints, and then put the anchoring screws in.
And Dr. Jay Lim is using this robot to do it, the only one of its kind in the area. He's performed the surgery 40 times, more than any other surgeon at Reston Hospital Center.
The robot is actually this device right here. This is the part that attaches to the patient. Once the coordinates are given by the planning station, this robot moves in all directions. This part right here is the guidance arm itself. So once this part, which is the robot, is set and positioned, we place this guidance arm on top of the robot. You can put the screws in. Okay, let me see the robot.
Although the robot does a lot of the work, this operation can't be done without the skill of a surgeon.
There is a learning curve to it because despite this fancy technology, you can still not do it properly unless you're trained properly and have some experience. But overall, I mean, studies show that this is probably about 99% accurate, as opposed to being about 90% accurate.
Along with increased accuracy, this surgery also has a faster recovery time.
Standard recovery from an open incision is about 3 to 6 months. With this minimally invasive approach, guided by this robotic system, I usually tell patients about 1 to 3.
And that's great news for Hung Kyun An. He's hoping to walk his daughter down the aisle at her wedding in March. And after that, enjoy his life to the fullest.
And I would like to have a very healthy life, whatever I have left, after my retirement.
After his retirement, Mr. An just had a post-op checkup last week and reports he is doing very well. Seems like he's on target for his daughter's wedding next month.